We're going to work on this patient's foot and ankle. She's been dealing with some lateral ankle pain and some midfoot pain. So I'm going to just take you guys through some of the adjustments that I'll do, some of the areas that I'll typically check when I'm adjusting someone's foot. Most people don't realize that we do adjust feet, elbows, hips, all the extremities here in the office, and it's a really important part of our practice. So we're going to do an adjustment here using the speeder board, and we're going to try to get a little bit more eversion, which is very important for the gait cycle. So I'm going to just have you rotate your leg out, and then we're just going to drop the drop piece straight down. Good, and then we'll recheck. You can see that opened up right there.